Hi, Dr. Dela Cruz here. Did you know that your teeth is killing you? You may be wondering how your teeth affects your heart. Well, I'm here to tell you that it's not just your teeth. Your oral health impacts almost every organ in the body. It affects your pregnancy health, your heart disease, Alzheimer's, and many more. According to the CDC, the number one killer in the US is cardiovascular disease. According to them, one of every 33 seconds, somebody will die of a heart attack. Did you know that nearly 50% of heart attacks originate in the mouth? According to Dr. Bradley Bale and Amy Doneen, half of the problem is in the mouth. They created the Bale-Doneen method based on their book, Beat the Heart Attack Gene. Their research was published in the British Medical Journal, and in there they outlined three major problems that contribute to heart disease. The first one is periodontal disease, tooth infection, and sleep apnea. They highlighted that periodontal disease and dental infection can cause heart attacks and stroke. I will read you a quote from Dr. Bradley Bale. He states that it is imperative that you get your teeth clean and your gums evaluated regularly and get optimal dental therapy because it is life-saving for the prevention of heart attack, stroke, and death. A very important fact that they mentioned in their study is that oral health and systemic health is no longer an association. It is a causative of cardiovascular disease. I will repeat, poor oral health is a causative of cardiovascular disease. In simple terms, poor oral health will increase your risk of stroke and heart attack. The next question you may be asking yourself is, how do I know if I'm at risk? I will outline as a dentist how we look for the three main problems contributing to cardiovascular disease. Number one, periodontal disease. In simple terms, periodontal disease is diagnosed by the presence of gum and bone loss around your teeth. We determine this by taking x-rays, measurements, and charting any presence of bleeding in and around your gums. In my office, we take it a lot further. We take samples of bacteria, put it under a microscope, and look at it on the big screen. There we're looking for certain bacteria. In fact, we're looking for certain shapes, but we're looking for spinning rods, gliding rods, spirochetes, amoeba, and trichomonas. We also take saliva samples and send it off to the lab to truly determine the types of bacteria in your mouth. That way we can create a specific game plan or oral treatment to get you back to healthy. Number two, dental infection. The way we look at this is x-rays and CBCT. What that is a 3D rendering of your mouth, and it allows us to look at teeth that might have potential infection or teeth that have been previously treated in the past, like a root canal, which may not hurt you but may still have an infection. And that's the dangerous part about that, is that infection can linger for time and you not even know about it. The third is sleep apnea. So the way we look for this in our office is with that CBCT machine. We can look in the airway and see if it is restricted. The other signs to that is flat or worn teeth, and also the sides of your tongue. If they're scalloped, it means that they're being pressed up against your teeth. And those are some of the early warning signs that you may have difficulty breathing. But to truly understand if you have sleep apnea, you have to have a sleep study test. So it's one of those things that we will send home with our patient to look at and see if they truly have sleep apnea. Now that you know the three major problems that cause or contribute to cardiovascular disease, you may be asking yourself, well, what can I do to treat it? Well, I will outline the 6 main ways we treat it in our office, and I will go to more detail with that in future videos. But the big one really falls down to periodontal disease. So the main treatments we do for that is pretty simple. A toothbrush. We do recommend an electric toothbrush. It does make a difference. Flossing and a water flosser. The second one is a specific rinse. So sometimes we use chlorhexidine, Therasol. There's many other kinds, but it's specific and it's not readily available over the counter, but you can find it. The third one is SRP. It's also known as scaling and root planing. So if you have bone loss and you have calculus and tartar buildup, the treatment is to remove that, which is basically a protective coating for bacteria to multiply. Number 4 is laser therapy. So take a little light, go around your gums, and we use that to kill bacteria. Number 5 is called guided biofilm therapy. That is a specific method in which we remove the plaque or the biofilm that forms on your teeth to disrupt the bacteria. And the last one, and I'll go more into detail with this in the future, is a probiotic lozenge. Basically, it puts your bacteria on a keto diet and it keeps them from producing the acids and the inflammatory problems that they create. So I just went through the different treatments for periodontal disease. When it comes to dental infection, it's fairly simple. You either remove the tooth or you retreat the tooth. And the last one is sleep apnea. So there's many ways to treat this, either a CPAP machine, a mandibular device, and there are surgeries associated with that too. I also want to give the last warning is if you are going to go through with this therapy, please follow up. Otherwise, your disease will return and you will be right back at zero. So all the time, money, and effort you put into taking care of the teeth will be for nothing. So please follow up.